Hi guys, it's me, Professor D, and welcome back to my YouTube channel. On this video, we're going to be doing another case study, and we're going to be covering bipolar disorder again, but this time, instead of covering the patient that's in the manic phase, we're going to be covering the patient that's in the depressive stage, having depression. Now, before we get started, as always, I'm going to ask you to please support me and support this channel by liking this video. You're going to love it. Go ahead and give it a thumbs up now so you don't forget. Subscribe to my channel if you haven't done so already. And be sure to check out my website, nexusnursinginstitute.com. There you can sign up for a next generation NCLEX review session, part 1 and part 2. You can sign up for a private tutoring session with me. You can sign up for a consultation session. Maybe you want to pick my brain about something. You need some advice within the nursing arena. Or maybe you're a current nursing student and you have to do really, really well on your next exam to even stay in the program. Check out my audio lessons. I made those audio lessons especially for students just like you. I've got lots of resources on my website. Be sure to check them out. Again, nexusnursinginstitute.com. Almost daily, you can find me covering a variety of nursing topics across my social media platforms such as TikTok, Instagram, Facebook, or right here on YouTube. My handle is the same everywhere, Nexus Nursing. Without any further ado, let's get started. Okay, guys, so we're going to be covering the patient that has bipolar disorder, but they are in the depression stage. So let's take a look. Patient's name, John Doe, age 32 years old, male, diagnosis, bipolar disorder type 1 with current depressive episode. Medical history, diagnosed with bipolar disorder, age 22, episodes of mania and depression throughout the years. No prior history of psychosis. Currently not adhering to medication regimen consistently. Medications, lithium 600 milligrams twice a day, olanzapine 5 milligrams at bedtime, sertraline 50 milligrams, discontinued by the patient a month ago. Allergies, none. Social history, single, unemployed, lives with parents, socially withdrawn, history of alcohol use, denies recent alcohol consumption, no history of illicit drug use, presenting problem, depressed mood, lack of energy, difficulty concentrating for the past month. Family reports he's been isolating himself, sleeping excessively, and showing signs of hopelessness. Subjective data. Remember, guys, subjective data is what they tell you. You can't measure it. Subjective data, the chief complaint. I just feel so empty and tired. I don't want to do anything. Mood, depressed, anxious. Sleep pattern, excessive sleep up to 14 hours a day. Appetite, decreased appetite, reports significant weight loss over the past month. Energy level, extremely low, has difficulty getting out of bed. Thoughts, expresses hopelessness and feeling stuck. Past mania episodes, denies recent manic symptoms, such as decreased need for sleep, impulsivity, and grandiosity. Objective data. Now remember, guys, objective data, this is what's measurable. Vital signs, temp 98.6, blood pressure 120/80, heart rate 72, respiration 16, O2 sat 98% on room air. Physical exam reveals the patient's disheveled with poor hygiene, a slight tremors noted in the hand, possible side effect from the lithium. Weight is 155 pounds, but they're down from 170 pounds 2 months ago. Mental status examination, appearance, disheveled, poor grooming, behavior, slowed psychomotor activity, minimal eye contact, the speech is slow, low volume, thought process, logical but slow, reports feelings of hopelessness, the affect is flat, and insight is limited, denies need for medication. And last, let's take a look at the diagnostic test. When we look at the lithium level, it's 1.2, and they were nice. They told us that it's within therapeutic range, right? Lots of questions you get, it will not tell you it's within therapeutic range. You need to know that level. Thyroid functions normal, CBC, and platelets normal, CMP normal, urinalysis negative for drugs or alcohol. Okay, so I'm going to scroll back up so you can take a look. You have an idea of what's going on with this patient. Oh, I can't. Okay. You see what's going on with this patient? I'm going to go over, I think there are 3 questions. I'm going to go over the 3 questions and I'm going to talk to you about some things I saw here. The reason I'm going to do the questions first, last time I just started talking to you about the case study and I accidentally gave you the answer to the question. So I'm not going to do that this time. We're going to do the questions first, and we're going to go back into the case study. And I'm going to point out some important information that you need to know that may be a test question for you because it's been seen very commonly on NCLEX and nursing exams. All right. So guys, you can't see the question. I'm going to read it to you. I'm going to read the options to you. So listen closely. Okay. I want you typing your answers on the live. Question number 1. What is a priority nursing intervention for a patient with bipolar disorder and current depression who expresses feelings of hopelessness and no desire to live? A, encourage the patient to engage in group activity. B, assess for suicidal ideation and ensure safety. C, offer relaxation techniques to improve sleep. Or D, educate the patient about the importance of medication adherence. I'm going to read it one more time. What is a priority nursing intervention for a patient with bipolar disorder and current depression who expresses feelings of hopelessness and no desire to live? A, encourage the patient to engage in group therapy. B, assess for suicidal ideation and ensure safety. C, offer relaxation techniques to improve sleep. Or D, educate the patient on the importance of medication adherence. What do you guys think? Thank you, Bucks. Okay, very good. Everyone is saying B, assess for suicidal ideation. Number 1. When you even suspect, so let's say you didn't even get a question that told you your patient was depressed, but they gave you signs and symptoms of depression, right? It doesn't have to be, the diagnosis doesn't have to be confirmed. All you have to do is suspect depression, and the first thing you're going to do is assess for suicidal ideation. And guys, here's how it works. The first thing you're going, wait, before I even give you the order of steps, let me say this. You're going to ask them directly. You're not going to beat around the bush. All right. When it comes to suicidal ideation, when it comes to abuse, and when it comes to emergencies, and you have to do a quick assessment, those 3 scenarios, if you get a case study about those 3 scenarios, or you get a question about those 3 scenarios, always, 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 you ask them directly, and the question is going to be closed-ended. It's not an open-ended question. You know how in nursing, we love to ask open-ended questions where we want the patient to be able to express themselves? Not in those 3 situations. If you suspect suicide ideation, you assess abuse, or you have to do a quick assessment for emergency, you're going to ask a closed-ended question, and it's going to be direct. So in this case, we're talking about depression. We want to make sure they don't have any ideations of suicide. You're going to ask them directly, are you having any thoughts of harming yourself? Yes or no? That's a closed-ended question. Yes or no? Are you having thoughts of harming yourself? If that patient says yes, the next question you're going to ask is how. Why? You want to know if they have a plan. And the reason you want to know if they have a plan, you want to know the lethality of that plan. So if they say yes, you're going to say, do you have a plan? How do you plan on doing it? And based on that answer, you really find out how lethal that plan is, how serious they are about harming themselves, right? They tell you that they plan on using the gun in their grandpa's basement that's not locked. Uh-oh, they have access to that weapon. But if they tell you they plan on jumping off of Mount Cashapp in a different country, okay, that plan may not be as lethal, right? So let's talk about the other options and why they're wrong. A was encourage the patient to engage in group therapy. Let me tell you something. That patient that is depressed, you better not encourage them to engage in group therapy. Why? Depression is anger, hostility, resentment, hopelessness turned towards who? Self. I'm so awful. I'm such a loser. I'm not worthy. Live restricted for some audiences. Oh, hold on, guys. It's because of the subject matter. Hold on. TikTok should allow content like mine. My live does not contain the content. Let me choose this. Okay, anyway, what was I saying? Oh, yes. You do not encourage them to go to group therapy because here's why. That patient that is depressed, you're going to work with them one-on-one. Why? You're trying to build up their sense of value in themselves. If you put them in a scenario where they're in group therapy with other people who have mental disorders or, may not be sensitive to them, what do you think is going to happen? They're going to come out feeling worse about themselves. Or they may feel like, everyone else has it together. What's wrong with me? I knew I was such a loser. How come I'm the only one who can't snap out of it? You better not. Okay. That is not the type of patient you send to group therapy when they're currently in the depressive state. So that's wrong. Next, offer relaxation techniques to improve sleep. To improve sleep, this patient's already sleeping 14 hours a day. When the patient is severely depressed, they don't have any energy to even get up and brush their teeth. All they want to do is stay in bed. Do you guys remember what happened to me about 2 weeks ago when I did that whole Kahoot and realized that it was not recorded? You remember how upset I got? What did I do? I got off the live and I told you I was going into bed and I was canceling all of my plans, right? Okay. They don't have the energy. All they want to do is sleep. So you're not going to teach them to relax to get even more sleep. We're trying to get them out of bed doing things. So that can't be the correct answer. And the last option was educate the patient about the importance of medication adherence. Let me tell you something. When a patient has something actively happening to them, that's not when you're doing teaching. Right? We do teaching once that patient stabilized. This patient is in an inpatient facility. We're the ones giving them their medication, right? So right now we're not too worried about adherence as we are about suicidal ideation. We don't want them to have a plan in their head and they've already decided that, you know what, I know the change of shift is at 3 o'clock. I know that. So at 3:02, while the nurses are still getting report, I'm going to go into the bathroom and follow through with my plan because by the time they come to check on me, I'll be gone already. That is going to be your first concern because who cares about anything else if that patient is. Do you guys understand what I'm saying? Does that make sense to you? Okay, let's move on to the next question. Question number 2. Which of the following interventions is most appropriate for a patient with bipolar disorder and depression who has stopped taking their medications? A, advise them to try natural remedies to manage mood. B, provide education on the consequences of non-adherence to medications. C, reinforce that medication is unnecessary for long-term recovery. Or D, suggest stopping medications to avoid side effects. I'm going to repeat that one more time. Which of the following interventions is most appropriate for the patient with bipolar disorder and depression who has stopped taking their meds? A, advise the patient to try natural remedies to manage their mood. B, provide education on the consequences of non-adherence to medications. C, reinforce that medication is unnecessary for long-term recovery. Or D, suggest stopping medications to avoid side effects. Very good. The correct answer is B, provide education on the consequences of non-adherence to medications. And I love that this is the answer. Why? For all you nursing students that wants everything to be cookie cutter, you want everything to be black and white, you want everything to be in the box, and you don't want to have to critically think. Do you see how for question number 1, teaching them about medication adherence was wrong? But in question number 2, teaching them about medication adherence was right. This is why I keep telling you, you can't memorize answers. It's going to get you nowhere because the right answer for one question will be wrong for another. You have to be able to apply the information that you know, guys, right? So in this situation, teaching is appropriate. Why is teaching appropriate? Because all the other answers are absolutely wrong. There's nothing else that you could have chosen, right? So we're not happy that the patient stopped taking their medication, right? They're not stable. They stopped taking their medication. However, when you look at all your other options, it couldn't be any of the other options. Look at our other options. A, advise them to try natural remedies to manage mood. Are you kidding me? Are you kidding me? You never advise patients about natural remedies and herbs. Here's why. Natural remedies and herbs and teas and all of those things, guess what? They have it's called drug reactions. They can react to certain drugs where it makes the drug toxic in your body, or it can make the drug have a subtherapeutic level in your body, right? It can be contraindicated. So you never do that. When a patient ever asks you about a drug or herb, you want to know what your answer every single day of the week is going to be? That is something that we're going to have to discuss with the healthcare provider. Why? The healthcare provider is the one who writes the orders for the medication, right? Okay. So it couldn't be A. Let's look at C. C says reinforce that medication is unnecessary for long-term recovery. What do you mean? Is there a cure for bipolar disorder? No, there's treatment. You're going to have bipolar disorder for the rest of your life. So guess what? You're going to need that treatment for the rest of your life. So it couldn't be that. Let's check D. Oh my gosh. Suggest stopping medications to avoid side effects. First of all, even if you did not have a brain cell in your body, if you look at the case study, it tells you that that patient had stopped taking the medication on their own. And here we are. So why would you suggest to them for them to stop taking medication? Let me tell you something. When it comes to these psychiatric drugs, and I don't care if it's for the manic phase, depressive phase, it could be for schizophrenia, whatever it is, when we're talking about mental health, all of these psych meds, they're never stopped abruptly. Okay, you stop a psych med abruptly, patient can have seizures, all types of issues that we don't want to run into. So when it comes to psych meds, if a patient has to be off of it, they're going to be weaned off unless it's a medical emergency. Okay, so you're never going to suggest that the patient stop drugs. Who stops drugs? The healthcare provider. They stop the order. As you, the nurse, you're giving a drug, you can withhold the drug. If something's contraindicated, if you're seeing an adverse effect, you can withhold it and call the healthcare provider. But even you're not going to stop the drug. Does that make sense? Are we all on the same page? Any questions, guys, before I move on to the third question? All right, let's keep going. Third question. Which statement by the patient indicates a need for further education regarding lithium therapy? A, I will go to my next appointment to check my lithium level. B, I will drink plenty of water to avoid dehydration. C, if I feel fine, I can stop the lithium medication. Or D, I understand that I need to take the medication as prescribed. I'm going to repeat the question. Which statement by the patient indicates a need for further teaching about lithium therapy? A, I will go to my next appointment to check my lithium level. B, I will drink plenty of fluids to avoid dehydration. C, if I feel fine, I can stop the lithium medication. Or D, I understand that I need to take the medication as prescribed. Very good. Everyone on the live is choosing C. That requires further, whenever it says which one requires further teaching, which one requires clarification, which would you question, what they're really asking you is for the wrong answer choice. And the wrong answer choice is C, saying if I feel fine, I can stop my medication. No, the heck. But everything else is correct. A, I'll go to my next appointment to check my lithium level. Absolutely, because we know if the patient's on this mood stabilizer, lithium level needs to be checked regularly. Lithium level therapeutic range is what? 0.6 to 1.2. Once that patient hits 1.4, they're what? They have a toxic level, right? That patient's lithium level is going to be checked, and periodically you're going to be checking their sodium level as well, because we know that sodium level will affect the lithium level. So nothing wrong with that. B, I'll drink plenty of water to avoid dehydration. Nothing is wrong with that, because if that patient's dehydrated, that can throw them into lithium toxicity. We're not playing with that. And then D, I understand that I need to take my medication as prescribed. Perfect. Nothing wrong with that. So guys, those were the three questions that I wanted to over. Now, let's go back to this case study because I want to point some things out to you. What do I want to point out to you? Give me a second. Let me read this case study, see what I want to say to you. Da, da, da. Oh, okay. Let's go down to presenting problem, depressed mood, lack of energy, difficulty concentrating for the past month. When that patient is in the depressed state, it's going to be hard for them to concentrate. So you have to give that patient instructions one step at a time. You can't say to them, "Oh, Mr. Smith, I want you to get up and brush your teeth and comb your hair, take a shower and get dressed." You can't. You have to say to Mr. Smith, I need you to get up. Watch him get up. Okay, Mr. Smith, now I need you to walk with me to the sink so you can brush your teeth. They brush your teeth. Okay, Mr. Smith, I need you to get in the shower and use soap. You have to give it step by step because their thought process has slowed down. Okay? That's number one. Number two, you cannot ask them complex questions. Their thought process has slowed down. And number three, you have to give them time to think about your question. When you ask them a question, it's going to take them longer to even process what you ask them and be able to come up with a thought process for themselves of how they want to respond. So you have to be patient. Okay, so many test questions come from that last statement that I just read, where it says they're having difficulty concentrating. I just thought of 5 test questions easily that you'll get in the nursing program. Next, where it says sleeping excessively, signs of hopelessness, even if depression was never mentioned, when you saw that, you should have automatically been thinking of depression. Now, let's talk about, well, let me keep going. Let me see what else I want to talk to you about. Physical exam, where you saw the slight tremor in the hands. This case study was very nice because they told you possible effects of lithium, but I'm telling you now, NCLEX will not be that nice. They expect you to understand, tremors, most likely it's lithium. Why? Because this patient has bipolar disorder, right? So even though they're in the depressive stage, they also have been in the manic phase. So those tremors may be caused by the lithium. So guess what? One of the things on our to-do list is to check the patient's lithium levels. All right. Nursing diagnoses for this type of patient. Do you have videos on nutrition? Yes, I do. Check my Fundamentals of Nursing playlist on YouTube. Okay, nursing diagnoses for this type of patient. Number 1, risk for suicide. That is your biggest priority that you have to get out of the way. Okay, rule out risk for suicide. Okay, because nothing else matters if they're. After that, imbalanced fluid and electrolytes, imbalanced nutrition. If you have to choose a priority between the two with imbalanced nutrition and imbalanced fluid and electrolytes, what are you going to choose? I'm talking to you guys on the live. I'm still waiting. Between nutrition and fluid. Thank you, Luann. Fluid and electrolytes. Why? Fluid and electrolytes will you much faster than lack of nutrition. Okay? So assessing for suicidal ideation, imbalanced fluid and electrolytes, imbalanced nutrition, imbalanced coping as well, because guess what? This patient's not compliant with their meds, so they're not coping well. But that imbalanced coping is going to be last on your list because when you're thinking about Maslow's hierarchy of needs, what's your priority? Physiological integrity, what keeps your patient alive? Coping is psychological, that's emotional. We don't care about that until our patient is physically stable. Physical always comes before psychological. All right? Okay. Let me see if there's any guys about. The last one was I didn't even mention that the 14-hour sleep patient is sleeping way too much. We want to get them out of bed, and there are some things you can do. It's very important, guys. Before that patient goes to sleep, do you think it's a good idea for them to have tea? No, tea has caffeine in it, or chocolate, caffeine in it, Cola, caffeine in it. Do we want them drinking alcohol? Absolutely not. They shouldn't be drinking alcohol because guess what? They're taking meds. Can you ever drink alcohol with meds? Absolutely not, right? You want to make sure you promote um, a calm environment at night, but during the day, guess what? You need to open up those blinds, let the sun in, make sure the lights on. We're trying to increase stimulation. We want this patient up. We don't want them staying in bed all day. Okay. As far as fluid and electrolytes, you're going to encourage them to, you're going to give them lots of bottled water, encourage them to drink, and you're going to work with a dietitian because you want to offer this patient high calorie, high carb foods. It's very, I'm saying high carb, high calorie foods. Calories give you what? Energy. We're trying to get this patient out of it. Tammy, I don't understand your question. What if they're lactose intolerant? What does lactose intolerant have to do with anything? Rick, would this patient need one-on-one supervision? If they are a risk, yes, absolutely. Absolutely. And when I say one-on-one, if they go to the bathroom to take a number two, guess what? That one-on-one is right there. You're keeping that door open because we have to keep eyes on you at all time. Absolutely. Did the person answer about the lactose intolerance? I want to answer your question, but I don't know what you mean. Okay. She said give milk before going. Who said give milk before going to bed? I didn't say that. Now, if the patient enjoys milk, they like to warm their milk and it promotes sleep. As long as that patient's not lactose intolerant, there's nothing wrong with that. Okay. Anyway, guys, I think that was not in this case study that, oh my God. I've seen this asked so many different ways. You're definitely going to get a question like this if you're currently in a nursing program. So just make sure you know it. When it comes to depression, you need to know the first line drug you expect that patient to be on is going to be, oh, what is it going to be? SSRI, because they're the most effective with the least amount of adverse effects. And the last class of drugs of antidepressants that you'd expect this patient to be on are the MAOIs. So after patients been on everything, they've been on the SSRIs, they've been on the TCAs, nothing else has worked, or maybe it did work, but here's the thing, after the patient's been on a certain drug for X amount of years or X amount of time, it's just not effective anymore. So after they've gone through all of these medications, nothing else works, and we have no choice. They have to be on an MAOI. But trust me, an MAOI is not the first, second, is down the list when it comes to anti-depressant classes because there are so many drug interactions. There are so many drug food interactions. Just forget about it. Okay. So make sure you guys know your SSRIs, you know your TCAs, you know your MAOIs, know what drugs fall under those classes, know the drug interactions, know the drug food interactions, and know your nursing interventions for those type of medications. Pharmacology is very big when we're talking about depression. Don't say I didn't warn you. Don't shoot the messenger. And guys, that's it for this case study. Let me know in the comment section what you thought about this case study and what you'd like to see more. Okay? I'm going to go ahead and end this video and I'll answer some more questions for you guys on the live.